You've had experience supervising many fasts. You've written a major book about it.
Right.
And you don't really do that now. You're not involved in the supervision of fasting as much now, I understand. Is that true?
Yes and no.
Okay.
I mean, because
I want to be accurate when I ask you the next set of questions, because I want to ask you, where do you see fasting fitting in?
I use fasting
in your mindset now.
Right. I might use fasting judiciously to aid people with as a part of my therapeutic protocol for various diseases, but it's not generally utilized for a person who's 50 to 100 pounds overweight or significantly overweight, who's an overeating food addict, who has trouble losing weight and has trouble staying on a diet. Fasting, and even intermittent fasting, where people do days of 500 to 600 calories eating. I don't even want to do that either. I want people to learn how to repeat and find what works for them, get into the program, learning the recipes and the meals, and structure the diet the proper way, have repetition of this program, which is going to afford them the ability to lose 2 or 3 pounds a week, that they're going to be between usually 1,100 and 1,400 calories a day, eating super healthy foods that fill them up and give them sufficient satisfaction. And then they can stay with this long term, because it may take them 6 months to a year to lose all their excess weight. And we want consistency and repetition and day in and day out, because and the abstinence from your addictive exposure to your love affair with your addictive substances. And I'm just saying that appears to have the highest probability of people having long-term results with less recidivism. The more you fast people that are overweight and still have a lot of food addictive tendencies, it leads to a higher, in my experience, a higher probability of them going back to overeating or going off the diet and gaining weight back after the fast, and then back to start square one again.
How do you feel about the approach of looking at intermittent fasting, where it's not so much a pattern of calorie restriction, but it is more a time-restricted pattern of eating? Do you see any benefit for people doing these 14-10 and 16-8 cycles of getting all their calories, but within a certain window of time that kind of respects the light-dark cycle, so to speak, which is a circadian rhythm? What do you feel about that?
Yes, that's what we do, and that's what we advocate. So that we do that particularly because detoxification and healing and the anti-aging phenomenons occur most effectively when you're sleeping at night, and they occur more effectively if you're not digesting food as you're sleeping, if your body is in the detox mode when you're sleeping. So we're trying to have people eat a light enough dinner and an early enough dinner, so they're going without food for enough hours before they go to bed, so they're not going to sleep with food in their stomach. So even if you stop eating 5 hours before bedtime, if you stuff yourself with enough food, you could still be digesting. You have to eat. You have to not eat till you're full, and you have to have So we're recommending that, yes, that when we want people to do time restricted eating, we generally don't want them to skip breakfast and start eating lunch at 12 or 1 o'clock and then eat late into the night, because they're still going to sleep on a full stomach.
Right.
We want to intermittent fast, so the episode when they're not eating is before bedtime, so they go to sleep on an empty stomach. I'm trying to do that, and sometimes I undershoot my caloric needs for the day, where I feel like I'm hungry when I'm going to bed at night. But I say to myself, well, that's good. The fact that I'm hungry means I didn't overeat today. I can have a little water and go to bed. I don't know, and when people will say, oh, I'm on this great diet, I'm never hungry. And I'm just thinking to myself, well, if you're never hungry, you're chronically overeating. Because if you're never hungry, it means you're always putting in more food than you really needed all the time. You got to have some hunger episodically to document the fact that you're not putting in too many calories.